All right, we're live.
All right. Good afternoon, everybody. I think you're aware of who I am. The purpose of today's presentation is to talk a little bit about how to approach the presentations that we're going to be giving as part of our respective residency programs and some suggestions from past preceptors and how to do that. I also do want to talk a little bit more generally about sort of my approach to how to get ready to present professionally, period, because really I see what you're about to go into as like one maybe arbitrary example of how to give a presentation, but an important kind of message I hope you get out of this is like not how to just get ready for Great Lakes or PSW or HOPA or whatever conference it is that you are attending, but anytime you're asked by your organization to talk about the quality work you're doing, research that you've done, that you have like at least a framework by which to approach that kind of ask that has at least been, successful to me over time. So that's where we're kind of headed today, is to talk a little bit about presentation basics, like what are some of the things I would have you think about before you get ready to present. We're going to get into some of the specifics of PSW and Great Lakes, where we are with abstracts, what expectations for those conferences look like, and then some past preceptor and residence lessons learned. All right. So this is, Harold asked if we had any participation pieces. To me, if, Jack were to come to you tomorrow and say, hey, I need you to give a presentation at the Inpatient Operations Council. To me, there are three main pieces of information that you would need in order for you to successfully do that task. And I guess this is where I'm going to open it up to this group. Can you guys help me identify what those three things are?
Knowing who your audience is or who you're presenting to.
Yep. Okay. What else?
Would one of them be to know what you're selling or the message you're trying to convey or what your persuasion is?
Yep, that's a good point. Yep. What is the purpose of that? What else?
Sorry, Dave, we were unmuted.
Yeah, you're good.
I was going to say who you're giving the presentation to and their knowledge level.
Yep. So audience, main message or purpose for you being there. I had some other ones.
How much time you have?
Time. Very good. That's definitely a key one. We'll talk a little bit more about why.
Kind of with the audience, the scope of it, if you're trying to give them a foundational understanding versus applying concepts, how advanced they are in their field.
Yeah, you guys are really focused on knowing what the audience level of knowledge is, which I think is really smart, right? Like you have to, that is who you're playing to, right? And so I think that's a key one.
Location.
What was that? I heard one more thought.
Sorry. Location, as far as
Thank
like
you.
virtual versus in person.
Thank you, Cece. So that would be, yes, good. So I think there are these three things we really need to know. The first that I have is you have to know your time limit. And I think that is the most, if you can only get one piece of information out of whoever you're presenting to, that is the number one most important one. And the reason I say that, right, is if you show up with 45 slides and anticipate a 30-minute review of, your entire project and the scope of the PGY1 project you did and what the pharmacy department does, and you get there and you realize that they only reserved 5 minutes for you, you have very little hope of on the spot like figuring out how you're going to do that, which is going to leave you an option of just continuing with the thing you had planned and destroying whatever meeting you just showed up to, or they're probably just going to cut you off after 5 minutes and then you're not going to get your main message through. So knowing how much time you have is like the most important thing. The same thing is true when we're presenting at ASHP, at the mid-year conference, or even at Great Lakes. We need to understand how much time we have to share with our audience. The second one is the one that Cece covered, and it's probably even more relevant now with the virtual world we live in as well. But knowing if it is a physical room that you're speaking out of, knowing what the room looks like. I was going to present a number of years ago at the Vizient conference, and actually ran into DZ, who was getting, I think, the first DASLA award or whatever the award in his name. And we actually went and did this together because it was one of the things DZ has like put into his preparation for any speech. He gets quite a bit nervous actually before he gives public speeches, and understanding what the layout of the room is, physically going up and like feeling what it looks like, looking out into the audience is one of those, I think, real important tricks that will help you. I'll also never forget, maybe a couple years ago, I was invited to go to I think it was the Excelsior building to present on indications, I think, for take-home drugs for Catherine Sensione's master's project, and had never been there before, didn't take my own advice, showed up to a room in a suit, and everybody else was in like cargo shorts and t-shirts in these like little rolly chairs. And we were all just like, there wasn't like a conference table, there wasn't a place to speak from, and like they never use PowerPoint, like they only just talk. And like I came like basically with no understanding of the room itself. And so that made that presentation much more stressful than it needed to be, because I didn't really have the tools I needed to do that. And this is where you learn things like sometimes you have to have a pointer or a slide advancer, because the layout of the room is going to require that, and you may not know that until you get there. So going and seeing the physical space that you're going to present in there is important. And obviously knowing, is it hybrid, is it in person and virtual, how is that going to take place is really important. And then the third one you guys mentioned is really understanding your audience's needs, right? So I think you guys really thoroughly covered this. We need to know what their current level of understanding is, and what it is that we need to convey to them as a result of that. So again, bottom line is anytime you're going to give a presentation, these are the first three things we need to clarify. Some other pieces that are core to this, and I think Harland kind of foreshadowed this well, which is we should not be settling for, hey, it'd be great, Harland, if you could give us an update on where we are with infusions, right? Like that might be what you are tasked with, but one should never like mentally accept that that's what we're going to do. No executive, no leader has ever really wanted to get a update message. And I've always taken that as really, this is an invite for you to send a message about like, to make an argument, as Harlan said, about like we're doing well, and here's how we need to get better. We're not meeting targets, and here's what we need to get back on track. Like we should never settle for like, I'm just going to tell them what it is and see what happens. Like, have a core message that you want to convey. And Lori and I were actually talking about this earlier this week with her hospital at home project. I think it's really important for any presentation that we come to agreement about what is the key message or messages that we want to send first, and then craft our presentations backwards from there. So I've seen a lot of times, right, for presentations that people are invited to give on clinical topics or administrative or leadership topics, where people are like, well, I have a title, so I'm going to start. This is going to be great. I'm going to write this presentation, create that title slide. Number two, like throw those learning objectives in a slide because those are already done. Wow, I'm just cranking along here. And then I'm just going to like start building forward from there and see what happens. And I think it is more likely than not, one of two things is going to happen when we pursue that. The first is we're going to like put in a bunch of background or interesting, you're going to get lost in the like story you want to tell with other things that are going to distract you. And I think subsequent to that, what happens is we lose what our main message is. And I think that's the second main thing, is that if we're not clear on what our audience is going to leave with in terms of a main message, it will get lost, and like you won't leave your audience with a core message, and then that often feels empty for those that have participated in your presentation. And so, one of my recommendations is always, if you aren't sure today what your main 3 or 4 takeaway lessons are from your PGY1 project that you're presenting, which is just an example of the next presentation you're going to give, like that's something to meet with your project team about and really clarify. Because once you have those pieces, I think it's a much easier process to say, okay, now how do I work backwards from that and say, here are the results I then need to show, here's where the methods are, and then to support that, here is the background information that sets up my audience's understanding of the methods, the results they're going to see, and the key messages that we're going to have them leave with. So like I've recommended for other versions of scholarship, this kind of like knowing what your conclusion is an important first step before we start putting together our presentations. My next bit of advice then is something that they used to teach in grade school that I think everybody gave up on, which including me for a while, which is to like create an outline first. Right? Especially with PowerPoint, it's like, let's just pound creating slides. And one of my core messages that I repeat all the time to JARS as we go through Drucker or other things is like, how can we be as effective as possible and efficient with the work that we're doing? And one of those things that can get out of control is that if we start to put together slides without really mapping out the content, we can end up spending a lot of time making slides pretty that will actually never make it to the final presentation. And that is like a feel bad and a waste that we should try to eliminate. So I think it's fine if you want to craft your outline in PowerPoint. I have no preference in how that is created. I guess my preference though is we work backwards in crafting an outline of here is how I'm going to get my audience to that conclusion before we jump in to create the visual story, the PowerPoint presentation that is going to then be the main message or be the presentation itself. And so again, my constant sort of push during this whole session is how can we try to best make this process as effective for you as possible, but also try to minimize the amount of rework we put into it. From a conference perspective, Drew is the trip coordinator, so he will be your point of contact when it comes to how are we getting hotel rooms, how are we getting registered, when are we leaving, like how are we getting there, like those portions of it, Drew will be in charge of coordinating. We're going to go through in a couple minutes the timeline of kind of important events when it comes to that. One of the things that drives the kind of timeline is if you have a conflict of interest. So if you do, your timeline might vary slightly differently. They request that presenters who have conflicts of interest turn in their slides earlier. So what I'm going to go through today does not have that specific caveat to it. So those dates won't apply to you. That has rarely been a thing unless you're engaged in a lot of outside activities outside of residency or have other business interests. Usually that's not an issue, but I would encourage you to let me or your RPD know as soon as possible if you have a conflict of interest. Abstracts. So one of the other messages around scholarship that I know we've talked a lot within the PGY1 pharmacy residency program is, one of those things we don't do when it comes to scholarship is to submit things with other people's names on them who have not had a chance to review them. One good way to burn bridges is to do that. And I've seen that happen over the years, and that's not a good thing to try to navigate because once it's out in the world with those people's names on it, it is very difficult to pull them back. I've gone so far at American Transplant Congress meetings and others to call attending physicians at home to get their verbal okay that yes, this abstract can be submitted because it should matter that much. When it comes to Great Lakes abstracts, there are some portions that I guess matter more to the overall process. So the first is really the title of your presentation is how it is listed within the app. So they have moved a couple of years ago to an app that presents all the conference information. And that's how people select functionally what they're attending. And it confuses folks when the titles you submit don't match what is on the screen when they walk in. So I would encourage preceptors and residents to not just put the title they've always had and just not think about it. Like when they submit their abstracts with the sort of mental framework of that's fine, that's just in the abstract and it won't matter. The abstract is where they pull your title from. And if your current title is 32 words long and is not going to make sense in a presentation, or you want to be clever about your presentation title, you need to change that now within the abstract. So would spend actual mental energy on the title now before that abstract is submitted. Learning objectives need to be or should be tied to the assessment that you're going to do. And then learning assessment questions are also one of those things that are difficult to change because again, through the app, that's how they award CE is people have to actually answer your questions. And so if you get feedback at your first presentation that these questions are horrible and we need to change them, that is not something that you'll actually be able to do because then your audience through the app to claim CE won't be able to, the questions you present won't match what's in their app, and that's going to cause them consternation. questions about those items. I did include, and I will send out these slides afterwards. I think this is actually a reference Philip provided. This is a document that really goes through like a good process for creating abstracts and posters and what the purposes are, particularly with a lens of quality improvement. So if you want a good checklist to also help you as well as other resources, this would be a good place for you to reference. For future presentations, so it's not uncommon for Great Lakes to provide a list of objectives for objective like Bloom's taxonomy words to choose from. Those of you who are in the teaching certificate course, I know this is something they beat you up with. You know, it's also certainly a part of the residency design, you know, Bloom's taxonomies and all of our learning objectives within the residency program. These are some good guidelines for how to craft learning objectives. It's really what you want your participants to be able to do as a result of your program. And that's really what ACPE's like preference is like we should be having sort of higher level Bloom's taxonomy learning objectives because we actually want our audience to be able to do things as a result, not have them at that sort of knowledge level, but it would need to be tied to the types of activities that you're going to have your participants do. So it may make sense to have kind of lower level ones for a presentation like Great Lakes because you're probably not going to do a lot of active learning strategies. That'll be different than if you present later at other larger conferences, either at a state or national level. They will typically push you to have higher level Bloom's taxonomy, more that evaluation synthesis type level, and then want activities that then are tied to that. Don't want to use acronyms in your objectives, and they usually, again, should be about doing and be observable and measurable. Lots of lists of Bloom's taxonomy sort of structures, what verbs to use are out there. I see Philip put one in the chat. This is another one from the American Academy of Family Physicians that I think actually Philip sent me in the past. For Great Lakes, make sure, you know, double check the format, make sure you upload it right. The current plan, and actually Megan is now tied to the executive committee of Great Lakes, so she'll get real-time information for this group if anything were to evolve within the conference structure. The current vision is that it will be in-person platform presentations like we did I guess 3 years ago now. We've not had an in-person Great Lakes for the previous 2 years. This important to note in terms of like thinking about the physical space of Great Lakes presentations. It is a screen that is always located behind you, so you won't be able to look at that. It is a laptop that will be on a podium. That laptop directly mirrors the image that is on the projector screen. So that what that means practically for you is presenter mode, like having notes attached to the slides, is unlikely to be helpful to you because like that is not what you will be able to display. So lots of times residents end up, you'll like actually have to bring paper and like bring that or have kind of memorized what it is you are going to say, maybe not verbatim, but like have good plans for that because you will not have the option of sort of like reading a script of notes in presenter view. Length is 18 to 22 minutes, and you will be stopped at 25 minutes. So hopefully that helps with some of those 3 things. And we'll talk a little bit later about that audience piece. The Great Lakes schedule posts in April. Historically, our group is large enough that we will cover both days of the conference, so people will need to plan ahead for that. Resident travel requests will need to be completed for all attendees. My understanding is that Drew is taking care of that for those attending Great Lakes. And just a reminder that abstracts are due on February 1st. Historically, if residents don't get abstracts in by the 1st, Tate Trujillo at IU does not accept any abstracts after the deadline on the 1st, and so you will not be allowed to present. No amount of begging or pleading seems to affect Tate particularly, and we have had the stance previously, if you don't have something to present, you would not attend the conference. So it's pretty important that we get those abstracts in by the 1st. There is no evaluation of the abstracts like the Vizient meeting. There isn't any like jurying or anything. So like you need to get something in by the 1st, but as we've already talked about, some parts are of core importance and others are not. In terms of the other like larger timeline, registration is due by March 1st. Drew will take care of that. April 8th, slides are due. There are separate deadlines for conflicts of interest or for individuals with those. My guess is that you guys will be then from 27th through the 29th of April. And I'll just put on your radar, in the past, we've asked PGY1s, or not PGY1s, we've asked residents to somehow summarize their projects to be shared either at staff meetings or to supplement the sort of quality project descriptions that we provide to the Joint Commission. We moved a couple of years ago to more of a using that A3 format to do that, if that's relevant for your project. I think more to come if that's something that we're going to ask residents to do this year. It does help us when it comes to sharing with others what we're doing. It makes it, I think, easier for Jack to share with Rick in a format that, you know, UW Health is used to for quality improvement work. So here are really the major outlines or deadlines that I would suggest. So the missed 121 abstracts are due then on the 1st. I would highly encourage people then, one of their next steps coming out of this meeting is to get a presentation and review team put together. That is usually made up of your main project advisor or team, a pharmacist that I think is impacted by your project, could be another like project team member, and then someone who is unfamiliar with your project. So this type of balanced perspective will help you have, I think, the right players in terms of, you know, content expertise and people who are not context experts in what you are working on. I think one of the challenges with only having perspectives that are close to your project is you all will inadvertently make assumptions about what your audience knows or understands. And so having this core team, I think, is a good idea. Traditionally, residents have included a co-resident as part of this review team to help with some of the note-taking, processing the feedback, those sorts of things. And I would encourage people to do that. My last bit of advice here would be the more consistency you have within this review team, the less likelihood there is that you're going to present it once to your team, get a set of feedback A, then present it again and get feedback that says for you to do the opposite of what the first group told you to do. And I think minimizes the amount of like back and forth you might get. So I think an important first step is to ask people to be a part of this group and to identify those individuals with your project teams. I would encourage you then to get that outline after you've talked about your core messages to your project and presentation team by early to mid-February. Give people some time to give you some feedback on that. Have a draft of your slides ready by beginning of March, and then start to get these practices in. You're going to want some time between your first and second practice, then some additional time between your second and third practice, depending on how those are going. Sometimes the content, if you do a really good job with the core messages in the outline, like you can get to a place where the visuals are good to go by a second practice. That, to be honest, is, and Megan can correct me, but I would say relatively uncommon, but a good stretch goal. And then what you could do is do that third practice and really focus just on the presentation, like the verbal part. And that obviously could be done anytime between when slides are due and the presentation at Great Lakes. So if you were to get delayed, I think that's your release valve. One of the things that will probably most help you is you got to get the team together. Once the team is identified, get these practices on the calendar. Even if you don't have anything today to say, getting these booked and reserved on people's calendars is an important next step so that you aren't competing later to get time. I would strongly recommend at least an hour. I understand that your presentations are only 21 minutes, but it is not uncommon to use a full hour for feedback, particularly for that first practice presentation. I have actually, I don't think, ever seen a Great Lakes practice presentation only take 30 minutes. Yet that's very tempting to schedule. I wouldn't recommend it. For PSW, we don't have that same like centralized, like Drew is in charge of scheduling it. So you'll need to complete a travel request form, make sure you're requesting meeting days and staff ready or through the ambulatory process. Their timeline is a bit different. I think abstracts were already due on the 21st of January. February 8th, folks will hear if you got a podium or poster. March 15th is the early bird registration date, and then you could be assigned either the 5th or 6th of April to present. I've outlined here, I think the way I would approach this presentation is identical to how I would approach Great Lakes. I just adjusted the timeline here because the date is earlier when you're presenting. The upside is you just come with your slides to PSW. There isn't a deadline by which you need to submit those ahead of time. I guess my last message here when it comes to any of these practice presentations is to me, it really doesn't count as a practice unless you just give the presentation. So again, even if you haven't thought about what you are going to say, obviously that's not optimal prior to your first presentation, but it has happened before. My recommendation is you should give it as though you are giving a Great Lakes presentation or PSW presentation and get feedback on that. Just talking through the slides rarely gives you the feedback you need to get the presentation to the next level. So would highly encourage you to just give it at those presentations and to have that be your approach when you walk into the practices. When it comes to the actual conference, I would just encourage everyone who is going to go to the presentations that are going to provide the most value to yourself professionally or to UW Health. It's kind of interesting. We've now not really had an in-person Great Lakes in a while, so we'll get to set what the new culture looks like. Previous culture was like all the residents went to their co-residence presentations. I understand the temptation to do that. You often don't know a ton about your co-residence projects and want an opportunity to learn about them. And this feels like a good way to do that and to support them. And I understand that. It also can be not as useful to you or others to have a room that is half full of UW people listening to UW presentations. So it has never been and is not required that you only go to UW Health presentations. It was one of those cultural things that just has pervaded the last 20 years. That is not the expectation. Go get other ideas. Go to where your PGY2 is if it isn't here. Go try to meet some new people, get some different ideas. That would be more valuable to UW Health in a lot of ways. And there is a speaker ready room. Highly encourage people to use that at Purdue. Have had a number of residents in the past who are very sure they uploaded the final version of their presentation to then get to the speaker ready room and realize they actually uploaded version 13, not version 15 like they thought. And it is far better to know that 2 days prior to your presentation than halfway through your presentation. You can't fix it, but at least you'll know and be able to plan around it. And the only way to know for sure is to go and use the speaker ready room and see which version is on their servers that you are going to be able to pull up for your presentation. And that's honestly just a good practice for any future presentation, and is a good reminder that version control matters. And if you have not yet mastered version control, this is a good way to do that. Have a separate folder of previous versions. Don't have them all in the same place. Name them very specifically, rename only one as final. Don't have one that's version final, or final in all caps is different than final in not all caps, or draft final is different than, we've all done those things and made mistakes. Don't do that for Great Lakes. It's a good thing to practice. I know Megan has seen some fun things with version control in the past. Presentation pearls. So here's a typical organization for this. And I'm going to pause here and say it's really important to me that people don't take into account what I have on the right, which is this is a structure that we have used in the past. Not all of these are required. And again, I would not start creating my presentation by labeling slides with each of these things and then pounding away and trying to put in content. That's always my hesitation about showing this slide, is that that's very tempting because you're like, look at me, I knocked out 12 slides and I'm almost there. And that is, again, not the philosophy we should be bringing to how we create presentations. At the same time, this is a good, at least, double check of, are we kind of in the right direction? So usually there's a title slide, a background that describes a little bit more about UW Health, something that gets into what your presentation is going to be about, purpose, objectives, the methods of the project, results, and then either a future directions or lessons learned or limitations depending on the scope, and then a conclusion statement at the end. Another
Dave,
important, yeah.
I was just gonna add in, do you want all the residents to have a standard UWHC background slide on what the organization is and kind of have a consistent message across the conference?
Yeah, let's, I'm going to get to that in 2 slides, Harold, and I will make sure to cover that. Thanks.
Sounds good.
My last important caveat is please do not put all of your learning assessments at the end. It is really important, like any bit of adult learning would say, you need to include those throughout their presentation in order to keep your audience engaged and to break up the presentation. And it's not a good approach in terms of, like, if you think about your presentation in terms of an arc, you want to end with something that tells your audience, like, now go do what I just taught you, and that's important. And like, it is a relative bummer to end a presentation with lame learning assessment questions. So your audience is going to leave with a worse impression of your project and kind of by proxy you if you just end with lame assessment questions. Title slide. The most important thing to me here is have an introduction that gets your audience's attention. It is not okay to stand up and read the title and give your name. So an important piece of how residents are introduced at an in-person Great Lakes is, I would say, hi, my name is David Hager. I'm here to introduce Harold. Harold is a PGY2 HSPAO resident at the University of Wisconsin Health. Harold. So that's about all you're going to get. And then my expectation would be that that would be Harold's cue to go through, like, to provide an introduction. So that could look like a story, humor, facts. Like, it is not okay though to read the title. If you start that way, like, you will lose your audience from slide 1, and that's kind of the opposite of where we want to go. That's the title slide. Background. So my preference is that we make sure that we describe ourselves as UW Health. I think it is nice to have like a version of, like, here are at least the data points that we're all going to use, so that we don't have different residents presenting our bed count, like ICU things, like how many facilities we have differently. My caution, though, is I think it is very ineffective to present a bunch of stuff about UW Health that is irrelevant to the rest of your presentation. So while I think having one source of truth for those numbers is important, I would encourage us not to present the same organizational background slide in each presentation, because the fact that we are an NCI, NCCN designated cancer center, level 1 trauma center, like, is irrelevant to 90% of the projects that are being presented and does not help your audience. And if we want to focus, that would be when we should, like, only messages that play to our final, like, key message. I think it is a disservice to your audience just to, like, ramble about things that don't matter about University of Wisconsin Health. People understand we are an academic medical center, and so I don't think, unless you need additional context there, that that's particularly helpful. So that's the note I have here, is like, what you're trying to do, the thought process would be, like, what you're trying to convey to your audience is, how does their site relate to my site, so that I can know the context of the work that is being done. And I think if you have that approach, instead of the approach of, Dave told me I have to have a background slide, I'm going to plug in what Drew makes for me and just talk about it so that people know something about UW Health, that would be the best approach, would be to think about, how does this help my audience understand, right? So I think all the time about projects that we've given in the past where it's like, they don't understand that, like, we have a lot of pharmacists, right? On the inpatient side, we have an integrated practice model where we touch every patient at admission and discharge, right? For some of these projects, that's really important, or the fact that we monitor every patient every day and have a pharmacist to patient ratio of like 1 to 14 during weekday AMs. Like, if you, that's the sort of stuff that if you are talking to other clinical pharmacists from other sites, they need to understand whether or not what you're proposing is a feasible thing for their site. And I'd much rather you go through that than say, we're a level 1 trauma center and the only stroke center in the area, and like stuff like that that isn't relevant to the rest of your presentation. Similarly, when it comes to background, the message here has to be about, why did we do your project now here? That is much more relevant than like, here are random like trials that say this is important. Either your audience will know that, or they'll still have the remaining question of like, yeah, but like, why'd you, out of all the things one could choose to do, why did you choose to do this project? So I would just make sure, if you're not clear on that, like, that's another important conversation to have with your project team. Like albumin use was kind of a mess, but like, why'd we choose to like focus on this now? And maybe you'll learn something, right? Like the critical care, like, leadership changed, or like we were seeing increased use of albumin products, and like we didn't know exactly how to combat that, and so we knew we needed to put it on the list, or something like that. Is really what we're trying to ask or answer for our audience, so that again, they can be like, oh yeah, like, I mean, I've always known we shouldn't use that much albumin, but we actually have some of the same motivations that they did to do this project now, so maybe I should do it as well. That's what we're trying to connect for our audience. And this is back to where we started in terms of, we need to remember who our audience are. It is broad. It's going to be a mix of leaders, residents, clinical pharmacists, but they are pharmacists. So we don't need to like spend a lot of time discussing the pharmacology of the drugs, of what albumin is, or like what roles it plays necessarily in therapy. Like, that should be pretty evident. Now, a caveat to that, right, would be if you're talking about a very specific oncology drug, or you're getting deep into the critical care literature about it, you may need to have a slide that says, hey, by the way, like, remember, like, every bit of published data shows these two products are equivalent, and here's the trial that did that. Like, I don't think we need to go through the methods and dive deep on that, but a reference point might be important for your audience. So think about it, but just remember who your audience is. Then we should hit them with a purpose statement. Again, the arc we're trying to do here is, introduction is like your sort of attention getting portion. Here's where we were doing that important work and what that looks like. Here's the problem we tried to fix, and then here is why my project was created. Here was the purpose for my project. The purpose was to reduce inappropriate use of albumin. It was to define the role of DVT prophylaxis in transplant recipients. It was like, what was that big problem that you were called on to solve? And then we can talk through what were the main phases of that. So to do that, we broke the project into 4 main objectives. Usually for quality improvement, it looks a lot like PDCA. We looked at the current state, we planned an intervention, we did the intervention, we studied the results. Obviously, for research, this would look differently, but these would be the main drives of quality improvement. Again, my plea to you would be, don't go back to your, if you did a project proposal, that's great. That's a good source of content and inspiration. Don't just like straight copy these things over. Things have likely changed, and you may need to simplify what was in those original objectives to make it easier for your audience to follow you. Your project objectives aren't learning objectives, they're not methods, and they're not a result or product. I'm sure many of you are like, yes, Dave, but I have no results to share. And I think that's like a common concern when it comes to Great Lakes, probably the most common one I have. And I think the main part here I'd like to emphasize is that that is not why your audience is there. Your audience is there because they want to understand what they should do because you've convinced them that this is a big problem and they want to know, how should I solve it? And so methods are really like, here's the recipe of what I did. And it should answer that question of like, how should I tackle this project? And how could someone else replicate it in the future? And so this is where we want the bulk of our presentation to be around, is what you did. And that's also what we're selling here, right? We're selling like you took on a big problem and you figured out how to fix it. And like, here's the work you did to get that problem solved. Sometimes people use the PDCA cycle as a way to structure these. One could use Cotter's model for change management, lots of ways to do that. And I do think it's important that you show or highlight that it's yours. Many of you are like really selfless people. You're high C's and high S's, and you're like, it wasn't me, it was my team. So you're going to want to give all the credit away. This is not one of those times. Like, this is one of those times for you to own that this is your project and these are things you did, even if it was with a team. Results then answer this question about like what came out of your work. We had lots of things in the past about how every result had to have methods and they had to correlate and you had to tie them all together. I guess I'm less about any sort of rigid structure that way, as long as we can tell the story we want to tell. In terms of wrapping up, it might be future directions, like what are the next pieces? What are some of the limitations that we have? Where are there things that we learned? And you definitely want to end with some strong conclusions about what you know and what you want your audience to leave with. When it comes to learning assessments, I think these are tricky. What we have found in the past is that this script is likely the best. By a show of hands, how many think the answer is A, read it, B, read it, etc.? You're probably not going to call on people. It's awkward the first time you do it, so I'd encourage during your practice presentations, again, that you present like you would at Great Lakes and practice how that would sound. These will have to be multiple choice questions. We should avoid negative questions. Shorter answers are better because you have to read them all, and so we don't want your presentation to be 2 minutes of pounding through the assessment questions. And I do think it needs to align with the main message of your presentation. There are lots of pearls here. I just know I have 5 minutes remaining. So practicing transitions is important. That's a hard portion of this. How are we going to get from every slide to the next? Trying to minimize text, more figures, more graphics, not necessarily more funnel smart art. Try to use similar fonts and colors, either have periods or not at the end of bullet points. Be consistent with how you space things. Try not to have things into third, fourth sub bullets. Sometimes it's hard for us to review the presentation so we hear it. So just understand that that might trigger more feedback. When we're giving presentations, thinking about physical communication, how our facial expressions, and then trying to sell the why. good idea to like practice the question and answer period. So after your presentation, preceptors will be allowed to ask questions. I find it best to designate somebody to like come up with a question during your practice presentation so that you can practice that. Have somebody to come with you to help synthesize the feedback. Simple charts are easiest. When we get to Great Lakes, it doesn't always have to be an RPD who introduces you. So we've had residents want to introduce their co-residents. I'm totally appropriate with that. Totally think that's appropriate. I think that's fine. And then my last bits of advice are we care about you and your ability to present. And we all know that you're capable of giving amazing presentations. And our goal is to show well at the conference and show them the quality of work we do at UW Health. And that can mean these presentations, these practice presentations, they feel like a lot. It can be a lot of feedback to take in. And I would just ask you to not take it personally, to understand that we are trying to help you get better in something that is important. Your ability to present is an important skill for you. And it's honestly something that we don't practice a lot in any of our residency programs. And so you should expect that you're going to get feedback about your ability to present, because it's just not something that we really focus on a lot. And I think one of the things residents often say is like, why do we care? Like, why do we spend this much time on it? And I think other people like come to our presentations to hear about what the nation's leader in pharmacy is doing. We want to kind of meet that need. And like, I think what you'll get out of this process is just how large and cool our projects are compared to a lot of what other people are doing. And we put this into the process because we really want you to get better at presenting, not just so that Great Lakes goes well, but that you're well prepared for future presentations. I do have some pretty old examples now at this point of good ones. I checked the links yesterday. They still work, and so we can send those out as well. If you just want to see like what a Great Lakes looks like, I think this is a good place to start. So you got Amanda Gordon here, and then Jen Garber. So some good oldies. All right, that's what I had to go through today. I'm sorry to not leave a lot of time for questions, but hopefully people found that valuable. I'll work with Harold and we'll make sure we get these slides out to everybody in follow-up.
All right. Thank you so much, everybody. Hope you have a great afternoon. Thank you, Dave, for your presentation. I'm sure it'll live in perpetuity.
Sounds good. Thanks, guys.
Yeah,